Seizure is a sudden outburst of electrical activity which often presents as jerky movements of the body, either a part of the body or the whole part of the body. If it just happens once, it's a seizure, but if it is recurrent, happening over several days, weeks, or even years, it's called epilepsy. In Nigeria, the prevalence is about 6 to 15 persons in 1,000 people who have a seizure.
How does a non-medical person understand that this person is suffering from seizure disorder, especially if the seizure disorder is not bringing out all these signs, the ones we used to jerking, foaming from the mouth?
When you see that you're talking to someone and the person all of a sudden blanks out, there's a brief period when the person blanks out. It's like the person is not there. You just keep talking to the person is not responding, and then you just keep talking. You call the person then comes back and say, I'm sorry, what happened? What did you say? The person has had a seizure. When an adult presents with a seizure for the first time, you must think of a brain tumor until proven otherwise.
Hello everyone, welcome to another beautiful episode of this interactive and educative podcast titled Ed Talks with Dukes. As always been, it promises to be an educative, interactive, and very intellectual discussion coming up in this beautiful episode. Once again, my name is Ayorinde Babafemi Babalola. With me today, I have a co-host,
Dr. Kind Precious. Our guest speaker for today is our very own world-renowned, highly intelligent and distinguished neurosurgeon. So I can
my name is Ifeanyi Emmanuel Iwabu. Thank you.
You're welcome, sir. So today we'll be discussing a very important but often misunderstood topic known as seizure disorder. Our speaker today is going to be enlightening us on the causes, the different types, how we can manage this disorder, and what we can do to prevent it and curtail it in the society today.
Thank you very much, Dr. Kalu. So, Dr. Ifeanyi, once again, you're welcome.
Thank you very much.
As she has rightly said, today we're discussing seizure disorders. Please, in simple terms, what is seizure disorder?
Okay, thank you very much for that question. Seizure is a sudden outburst of electrical activity which often presents as jerky movements of the body, either a part of the body or the whole part of the body. But it can also present in other forms, okay, like loss of consciousness, falls. Okay, it doesn't necessarily need to be jerky movement. So it's simply an abnormal burst of electrical activity, and it's sudden. When it happens like that, it's a seizure, right? And if it just happens once, okay, it's a seizure. But if it is recurrent, happening over several days, weeks, or even years, it's called epilepsy. Right. So when we say seizure disorder, it can just be like a simple seizure where the person has an episode of seizure, or it can't be an epilepsy, but we refer to as seizure disorder. So that is a simple way of defining what a seizure is: a sudden burst of electrical activity which is abnormal. Okay, and it can either present as jerk movement or a drop attack or a loss of consciousness, okay, of the in the affected individual. Yeah, so that is basically what it is. Thank you.
Thank you, sir. That was very insightful. So, like you mentioned, what are the different types of seizures, and how can a non-medical personnel distinguish this? Just say someone falls by the roadside is having a seizure. How can someone who is not medically inclined distinguish, this is a seizure, this is a generalized seizure, what are the types and how can it be distinguished?
Okay, thank you very much for that question. Before I address that question, I'd like to give a little information, just to add to what I said earlier. Talking about seizure, it's important that people understand how common seizures are, right? So the global prevalence of seizures from a study that was done in 2019 was put at 3 to 37 per thousand persons. So that means that 3 to 37 out of 1,000 people, had seizures as at that time that study was done. But in Nigeria, the prevalence is from 6 to 15 per 1,000. That is about 6 to 15 persons in 1,000 people, have a seizure. Yeah, so that is how common seizures are globally and in Nigeria. And usually seizures tend to be more common in children compared to adults. When an adult has a seizure for the first time, okay, most it is usually as a result of a brain tumor until proven otherwise. But having said that, let me address the question you then ask. So we can classify seizures in different ways, right? Well, one of the ways we can classify seizures is based on the focus of the abnormal electrical activity. So the brain has two hemispheres, right? So if the focus of the abnormal electrical activity comes from one part of the brain, okay, it will then give what we call a focal seizure. That means just one part of the body is affected, not all the body. So that's one way to classify. So the focal seizure. Then there is when the seizure focus, is coming from both hemispheres. You know, we say it will now present as loss of consciousness, okay, or patients have jerky movements affecting all parts of the body. So that is a generalized seizure. So there's a focal seizure, there's a generalized seizure. Then there is also another one where the focus starts from one part of the brain, but then spreads to, affect both hemispheres. So that's what we call a focal seizure with secondary generalization. So that is one way, seizures can be classified. The other way seizures can be classified is based on, the pattern of that seizure, the clinical pattern of that seizure. So there's what we call a generalized tonic clonic seizures, which is the most common of the seizures that people are aware of, right? So in generalized tonic clonic seizure, it just simply means that the seizure is a generalized seizure, but it has there are two parts to it. In one part of it is that there's a phase where the muscles are all stiff. I mean, that is the tonic phase, and then there's a clonic phase where the person experiences, abnormal jerky movements. That's what we call the clonic phase. So it's generalized tonic clonic seizures. It's one of the types of seizures, and actually is the most common. Then there is what we call the absence seizure. Absence seizure is this type of seizure. People are not used to it, but it exists, right? So in absence seizure, the person just have this suddenly becomes blank, right? It's a form of generalized seizure. The person becomes blank, does not is completely unaware of what is happening. There's no jerky movement in absence seizure. That's what we call the petit mal. Okay, the generalized tonic-clonic seizure is called the grand mal seizure, right? So that's also another type of seizure. And then the other type of seizure is what we call the focal aware seizure. Basically, it was called simple partial seizure. It just means that the seizure is affecting one part of the body, right? Then there is a focal unaware seizure, or what people call the complex partial seizures. Basically, this is a focal seizure, but then there is also unawareness. Person is not aware of his or her environment. Okay, so that's what we call a complex partial seizure. So these are the various types of seizures. I mean, there are other ways to classify seizures, but I just want to, talk about this. It's actually simple and they're easy to understand. Okay, when we look at it from the focus of origin of the seizure and as well as the clinical manifestations. That there are other types. There's what we call the tonic seizures. There's also what we call the atonic seizures. And then, of course, I've mentioned the absence seizure and the rest of them. So, but these are all types of seizures. But what's important is that one is able to identify when someone has a seizure. That is the most important. And why we're doing this podcast, because we want to educate people. Seizures are not just only when the person is jerky, foamy, or like foamy and bringing out saliva
From the mouth.
from the mouth, okay, or the eyes rolling upwards, or the jerking. So all these are they are common, right? But there are other manifestations which people need to understand, and that's why I'm mentioning what called the absence seizure, right? The tonic attacks, the atonic seizures. These are all types of seizures. But because people are now aware, they would not think that a person having those experiences have a seizure, and they are likely not to do anything. So they need to understand that these can be seizures. These are different manifestations of seizures, and then they need to now take the person to a hospital for a doctor to treat that person. Thank you very much.
Thank you so much, Dr. Ifeanyi, especially dissecting the various types of seizures. Now, how does a non-medical person understand that this person is suffering from seizure disorder, especially if the seizure disorder is not bringing out all these signs, the ones we used to jerking, foaming from the mouth? How does a non-medical person recognize someone suffering from a seizure?
Okay, thank you very much for that question. Okay, so I think, like you said, what is more common is that the person, is jerky. There's making some abnormal movement that they cannot control. Okay, that one is easier to identify. Or the person falls down, bringing from somewhere. Now that's a common one, also the more common one. So now, when you see that you're talking to someone, okay, and the person all of a sudden blanks out, there's a brief period when the person blanks out. It's like the person is not there. Okay, you just keep talking to the person is not responding, and then you just keep talking. You call the person, John, I've been talking to you for the past 5 seconds or 10 seconds or 30 seconds. The person then comes back and say, I'm sorry, what happened? What did you say? Do you understand? The person has had a seizure, most likely. Like I said, in absence seizure, the person blanks out for a while and then comes back to their awareness.
Does a person need to do that often?
So the thing about seizures is that they don't just happen just once. If it happens once, you need to observe it. It happens again, then it's very serious.
Within a short period of time?
It mustn't even be within a short period of time. Maybe it's a time difference of 1 day, 2 days, 1 week, 1 month. As far as it has happened before, even if it's a year ago, if it happens if it happened before and it has repeated itself, you need to pay attention to it, right? So that's one way seizures can present, and you need to understand that and then know what to do. Then another way a seizure can present is that the person is just walking on the road. There's this person apparently looks normal, but then as the person is walking, suddenly the person falls down. Nobody pushed the person, nothing. There was no form of push from anyone, and the person just falls down. Okay? And after a while, the person stands up by himself or herself. That could just be a tonic or an atonic attack, right? And so that, most likely is a seizure. I mean, it could be any other thing, but you need to, think of a seizure too as a possible cause of that event, right? So if it then happens again, you need to take the person to a doctor to evaluate that person and for possible, treatment. So these are the common ways, a seizure can happen. Or you notice that someone, starts smacking the tongue or the lip or closing the eyes abnormally in an uncontrolled fashion, okay, which stops after a while. It may be a pointer to a seizure. So the point is, a seizure can either manifest as a motor event, okay, or a sensory event, right? It could even be that the person starts having abnormal sensation, on one part of the body that just lasts very briefly, and then after a while, it start happening again, okay. So it doesn't necessarily need to be a jerky movement. That's the point here. It can be, in other forms, right? But it's important that people identify that this is abnormal, okay, and it needs, to be evaluated by specialists, most more appropriately by a neurologist or a neurosurgeon. Do you understand? So these are the common ways people can identify that someone had a seizure, and then, to then take the person to see a doctor. Yeah, thank you very much.
Thank you very much, sir. Thank you for shedding light on the different ways seizures can manifest. So, during your introductory speech, you made
Yeah.
mention that seizures are quite common in children,
Yeah.
and that if a seizure should occur in an adult, it's most likely a brain tumor.
Yeah.
So, what are the other causes of seizures?
Oh, thanks a lot for that question. Okay, so we can actually classify seizures, the causes of seizures, into two types, or two broad, categories. So we can have what you call the traumatic causes and the non-traumatic causes. So the traumatic causes will be something like, a traumatic brain injury. Let's say someone was involved, in a road traffic accident, or someone received a hit on the head, okay, and then that injured the brain, and then that can then trigger this sudden abnormal burst of electrical activity from the brain, which can then manifest as a seizure, right? So trauma is one of the causes. And then non-traumatic causes, there are a lot of them, right? Now, one of the non-traumatic causes could have been an infection, okay, like a brain abscess, an intracerebral abscess, okay, or what you call a subdural empyema, when there's pus forming, between the layers of the coverings of the brain. Okay, so that's what goes subdural empyema. Or someone even have, pus in the water chambers, that's the ventricles of the brain. Okay, that's a ventricular abscess. Or someone has what you call meningitis. That is inflammation of the coverings of the brain, right? So this can cause a seizure. Whether it's in a child or an adult, it can cause a seizure. Then another cause of seizure is what we call neoplasia. That is brain tumors. So a brain tumor, can cause a seizure. And like I said earlier, that when an adult presents with a seizure for the first time, as an adult, you must think of a brain tumor until proven otherwise. Okay, so brain tumors are a common cause of seizures. Another cause of seizures is the vascular causes, like someone who has had a stroke, can either be an ischemic stroke or a hemorrhagic stroke. Okay, so when a person has a stroke, it causes injury to the brain cells, and that can then trigger the brain cells to now give out this abnormal burst of electrical activity that can present as seizures. Another cause of seizure is what we call endocrine causes, like patients who have hyperthyroidism, or maybe have hypoglycemia from one metabolic cause or the other, can also have a seizure, because these states tend to they kind of reduce the threshold for the brain cells, generating abnormal electrical activity, and that can then cause seizures. Patients who have autoimmune disorders like systemic lupus erythematosus, they can also have seizures. Patients who have connective tissue disorders like Ehlers-Danlos syndrome, they can also, have seizures, because this affects, the interstitium, the supporting cells in the brain, which can then impact on the activity of the brain cells themselves. Other causes of seizures include things like fever. Now, fever can cause seizures, especially in children. What we call the febrile convulsions. We call it occurring in children. That's why we advise parents. When your child is burning, when your child is having fever, don't take it lightly. One of the first things you should do is to tape-spon the child to reduce the temperature of the child, or give, if you have paracetamol, like an antibiotic agent, and you've been told how to give it, you can give the child as a first aid. But what you must do will be to take that child immediately to the nearest hospital for treatment, because once that child start having seizures, it will cause injury to the brain of that child, and we don't want that, right? So these are some of the causes of seizures. I mean, there are other causes, but these are the commonest ones. Like I've just talked about infection, brain tumors. Okay, vascular events. Okay, these are some of the common causes of seizures. Yes, thank you very much.
So moving on, what are the typical warning signs before a seizure occurs?
Well, so that's what we call aura, right? Which basically is an event that tend to happen before a seizure occurs. So in an aura, the person may have abnormal, they have what you call hallucinations, have abnormal feelings, like maybe person is feeling something on the skin, or crawling on the skin, or the person begins to perceive things that actually are not there, or begins to see things, what called visual hallucination, that's not there. Okay, or it could just be that the person, tend to hear things, when actually there is nothing, nobody saying anything to that person, or called auditory hallucinations. This is one of the things that may happen just before a seizure event, but it's not it doesn't happen in all types of seizures, right? So in essence, there's really no warning event, if I want to put it that way. Like, if a seizure is going to happen, right? You don't get to know. It just, because that's why it is sudden, okay? And that's why, it is sudden, because it just happens. It's not like you plan for it. It doesn't tell you. And that's the very reason why we tell people who have had a seizure that, when we've had a seizure, you're being treated with a seizure, please don't drive. Okay, please don't go swimming on your own. Please don't operate heavy machines. Please don't be around the body of fire all alone. There must be someone, keeping an eye on you. The simple reason is because the seizure can just happen. It will not come and it will not tell you, oh, hello, I'm about to come. It won't tell you. It will just happen. However, there are seizures that patients do have, and just before they have the seizure, they have what we call an aura, right? Which I talked about earlier. So that is basically it. So it won't warn you, right? So that's basically it. But it's also important to reduce things that can put the person at risk of seizures. That is, preventing risk. Like I talked about, if someone has infection, treat that infection, especially if the infection is in the brain or the spinal cord, brain especially. You want to treat that infection. You don't want it to cause a seizure in that patient. If the patient has a brain injury, you want to treat that patient appropriately until the patient recovers, and you keep a close eye on that patient. You don't want that patient to have a seizure. If the person has a brain tumor, you want to treat that brain tumor. You want to get the brain tumor out of the brain as soon as possible, because you don't want it to cause a seizure in that patient. Because once a seizure happens, the likelihood that seizure will come back is very high. So the person is like going to have a seizure again even after the first one. Do you understand? So that's why it's important. So it's not going to warn you. So it's better you prevent, it's better you avoid things that can put the person at risk of having seizure, just like we've talked about. Okay. So these are basically what people need to know. More importantly, like I mentioned earlier, people need to understand the identification of this thing, because once you can identify it, then you can take the appropriate steps, to then treat it, which would then be to take that person to a nearby hospital. Okay, if you don't know what to do immediately. Do you understand? Okay, thank you very much.
Thank you, sir. Thank you so much.
You're welcome.
So we've talked about the warning signs, the causes, the different types of seizures. Now, how can seizure disorder be diagnosed? Is there a role for neuroimaging, or do we base solely on the symptoms the patient is presenting with?
Oh, thank you very much for that question. All right, so seizures, like we've talked about, can either present as jerky movements, like we've talked about. It may also present as a sudden fall. Okay, a person who has a syncopal attack, which is what we call fainting, can also have a drop attack, right? But seizures can also cause a drop attack. That's a fall, a sudden fall. Kind of explain it, right? And then, like I talked about, the sudden blanking or unawareness, it can present like so. When a patient has the symptoms, right, the person then needs to see a medical doctor. More importantly, a specialist like a neurologist or neurosurgeon. Now, when the person sees the neurologist or neurosurgeon, the neurosurgeon or the neurologist would then listen to the story of that person to understand what you call the semiology of the seizure. That is the pattern of that seizure, how it is how it has evolved, from the time of onset of the seizure to the time the person presented. So we need to understand it, and then the story of that person would also give the neurologist or the neurosurgeon an idea as to whether the seizure is a focal seizure or a generalized seizure. Do you understand? Then after that, the specialist would then examine the patient to establish if this person has neurologic deficits. Having done that, then the person would then, of course, examine other parts of the body, and then make what we call a clinical diagnosis of what the person's condition is. Now, having done that, the specialist will request for some investigations. Now, one of these investigations is what we call a brain MRI. Okay, that's a brain magnetic resonance imaging with a contrast. Okay, so or it can even be a brain computerized axial tomography scan of the with contrast, right? So this is like imaging studies of the brain that will help the specialist to identify if there is a structural, abnormality in the brain that is responsible for this seizure. Do you understand? Now, another investigation that can be done is what we call an EEG. That's what we call an encephalogram. Okay, so it's basically shows the electrical activity in the brain. So the encephalogram helps the specialist to then identify the type of electrical activity coming from the brain and where in the brain it is coming from. So it can give the specialist an idea of where the focus of the seizure is coming from. Okay, so that's basically what the EEG does, but of course, there are other investigations that may be done based on what the suspected cause of the seizure may be. Okay, if someone suspects the person has hyperthyroidism, you want to do a thyroid function test, to establish that, or you want to check the random plasma glucose of the patient to rule out hypoglycemia or things like that. So there's a lot of tests that can be done, to evaluate a patient who have, a seizure episode. But the first images we we do basically is the one I mentioned earlier, which is a brain MRI, a CT scan, and as well as an EEG. Okay, there are different types of EEG. Okay, so but these are the basic ones that can be done to then help the specialist to identify what is the cause of the seizure, whether it's structural or not structural. If it's structural, then if it's a neurosurgeon that saw this patient, then the neurosurgeon would then counsel the patient and their relatives about the findings and the options of care. Usually it would be a surgical removal of the lesion, the lesion causing the seizure, right? But if this patient was seen by a neurologist, then the neurologist, after seeing and counseling the patient, would then refer this patient to a neurosurgeon. Do you understand? But if it's not a structural lesion causing the seizure, then of course the neurologist would then treat this patient with medications we call anti-seizure medications, right? In fact, for every type of seizure, right, whether the person was seen by a neurosurgeon or a neurologist, that person would be placed on an anti-seizure medication in order to control those abnormal electrical activity, because you don't want that kind of abnormal sudden electrical activity from the brain. Yeah, so the person will be placed on anti-seizure medications, and then of course, in addition to the surgery, assuming it's a structural lesion in the brain needing surgery, right? But if it doesn't need surgery, then the person would be placed just on the medications to control the seizures. If the person remains seizure free for 2 years, okay, at least 2 years, right? So the person would then have to be, of course, there will be regular follow-up, of that patient, both clinically and radiologically, to see that the patient is actually seizure free, that there's no new problem, okay, clinically and radiologically. So if after 2 years the person remains seizure free, then the doctor, the specialist, would then start tapering or start withdrawing the anti-seizure medications over a period of 6 months to 1 year. So that's what we call tapering. So you have to taper off the anti-seizure medications. So the reason I had to say this, because I've seen a lot of patients that are being treated for seizure disorder, whether it was due to brain tumor or not, and then when you place them on anti-seizure medication, they'll take the anti-seizure medication for a while, and after a while they feel that they don't have seizures,
and they stop.
They will stop taking
without
medication.
Consulting their specialist.
Yes, without they do it on their own. Okay, so and we warn them. No, that's completely unacceptable. It's actually bad. They're actually putting themselves in danger. Okay, because like we said earlier, the seizure would not warn you when the seizure wants to come. It won't warn you. So the person has to be seizure free for a minimum of 2 years, okay, before the person would stop anti-seizure medication. And it has to be based on instruction of the specialist. And even the specialist would not stop you. The specialist would withdraw the anti-seizure medication over a period of 6 months to 1 year. Thank you very much.
So very quickly, let me paint this scenario. I was in a motor park.
Okay.
So a lady was standing beside me. All of a sudden, she started jerking. She fell down and started foaming. Everyone ran off. I was the only one standing beside her. I wanted to help.
Yeah.
But I didn't know what to do.
Wow.
So as a bystander, what could I have done to a person being affected by seizure beside me?
Oh, excellent question. Okay, so when a person has in fact, I'll try to address the question, and I basically also address some misconceptions people have about seizures. Okay, now, so when you are close to someone who's having a seizure, you don't need to run. You need to be calm, right? What you need to do is to support that person. Call for help immediately, okay, and then support that person. So what can you do? Try and get a soft, if there's a pillow around or something, just try to keep the person on the side and support the person with the pillow, because the person is jerking at that moment. Like you said, the person can injure him or herself. So you remove anything that is a sharp object around that person that can harm that person. So quickly remove it. Put a soft pillow around the head, the body, and put the person on the side, either the left lateral or the right lateral side, okay, so that the tongue can fall off from the airway and not block the airway, okay. So while you are waiting for help, that's what you can do. So there is this misconception that people say that whenever a person is having a seizure, you just look for a spoon or something and stick it in the mouth of the person,
between the teeth, so that the teeth will not grasp each other. I was coming to that.
So that's completely wrong, okay. You shouldn't do that, and for obvious reasons. Number one, you can injure the person. You can, either dislodge the tooth, and the person can just swallow it, and that can either enter into the airway and cause respiratory problem for that person.
What about addition of onions to the faces of those suffering so that their eyes will not get closed? As done by our mothers in those days.
Yeah, so that's one of the misconception. Is wrong. Okay, you don't use harmful objects. Okay, whether it's onion, harmful things, whether it's onion, application of onion on the face or the eye, or sticking of spoon, okay, into the teeth, which can either dislodge the tooth of the person and cause more harm to the person, or try to put your hand in the patient's mouth, to prevent the teeth from coming together. You can lose your fingers, by doing that. So it is not advisable. What you should do is to put the person on the side, put soft pillows around the head and the body, remove sharp objects around the person. Make sure there is nothing that would harm that person, okay, around that person. So do that, and as you're doing that, call for help so that people can help you. Take that person to a nearby hospital where they can, give the person, appropriate treatment. It's not something that you should, actually be worried about. And of course, like I said, I want to talk about misconceptions quickly. People have this misconception that, seizures, is contagious. That's when someone having a seizure, don't go close to that person.
Don't touch the saliva.
The person is going to infect you.
Exactly.
Contagious. No, seizures are not contagious, right? And so that's why we're doing this awareness discussion. People need to understand that seizures are not contagious. So the focus is from the brain, the neurons in the brain, right? The neurons are misbehaving. So it's not like a sexually transmitted infection. It's not like cough, that when person cough can spread it to the air and another person can inhale it and
viral disease.
Yes, viral. The person gets infected. No, it's not a contagious disease. That's number one. Number two is that people think that when the person is having seizure, the person is on Ogbanje.
Yeah,
that is completely a spiritual attack. So they say, oh, this person has a spiritual attack, this thing, this, that. No, that is a complete fallacy. Okay, it has nothing to do with Ogbanje. It has nothing to do with spiritual attack or your enemy has come for you. Maybe your child or somebody's having a seizure. You say, "Oh, my enemies have come for me. My enemies have succeeded." It's completely wrong, right? So those are all misconceptions about seizures, and people need to understand that it has nothing to do with that. Or people even say that when a person is having a seizure, the person will swallow their tongue. Oh, that's completely wrong. The tongue cannot be swallowed because the tongue is attached to the floor of the mouth. So a person cannot, swallow their tongue. So these are some of the misconceptions people have about seizure. Another misconception is that when they think that when the person has a seizure, that person has a mental illness, or the person has a low IQ. Oh, that person that's having a seizure, don't go close to that person. That person is a good for nothing person. People have all this kind of misconception in mind. So what we are saying today to everyone is that these are misconceptions that are completely baseless. Okay, there's no truth in them, right? If you see someone with a seizure, okay, you need to help that person. And seizures can be, controlled. They can be controlled, right? They can be treated. And someone that has a seizure can actually live a normal life. People think that people that have a seizure cannot live a normal. They can live a normal life completely. Just like someone, that's infected with human immunodeficiency virus, HIV, they can also live a very normal life. So people who have seizures can live a very normal life. They can walk, they can do everything other people can do. Normal, right? So people need to understand that. And just to say it, if you're listening to me, you're watching me, and you have a seizure that's being treated, or you have someone who has a seizure disorder that's being treated, I want you to understand that you can have a normal life as long as you are being treated appropriately, you are compliant with your treatment. You can live an excellent life, you can live a happy life. Okay, I want you to understand that, right? Don't let anyone talk down on you or say anything against you. Do you understand? All right, yeah. So I believe I've addressed most of those misconceptions, and I've answered your question. Thank you very much.
Thank you very much, sir. That was really, really insightful.
Thank you.
So, are there like complications that can arise from someone having seizure or epilepsy in the long run? Are there complications?
Well, okay. The seizures itself, if when it's not treated, it can cause a lot of problems. So apart from the fact that it causes injury to the brain cells, because as the brain cells are generating abnormal electrical activity, they are using a lot of the substrates, in that the brain needs for its normal activity, and then also they also generate some metabolites that can also be harmful to the brain. So we actually don't want the brain to do that, to start generating abnormal electrical activity, because it's that activity itself is harmful to the brain cells themselves, right? But beyond that, um you know if a person is having seizure and is not controlled or doesn't have help, that person is at risk of bodily harm, and which can range from the person being impaled. If there is a sharp object around, the person can be impaled. The person can get a laceration from sharp object. The person can be burned by fire if the person is close to body fire. The person can drown if the person is close to water or swimming, as at the time of the onset of the seizure. The person can actually be crushed if the person is operating a heavy machine or is close to a heavy machine that is moving. The person can be crushed. Okay, so ultimately the person can lose his or her life from seizures. So seizures, can be controlled, they can be treated, but when they are not controlled, when you ignore them, they can lead to the death of the affected person. So we don't want that. So when we talk about complications, these are the problems that we that the seizure that we can talk about when we talk about complication arising from seizure. The seizure itself can cause injury to the brain, but then the person that is affected would have can is exposed to a lot of dangers, which I would want to describe as the complications in this context. Yeah. So it's important that the seizures are controlled. Very important. Whoever has a seizure, if you know someone that has a seizure, please take that person to hospital to see a neurologist or a neurosurgeon, so that they will get the appropriate treatment for their condition. Thank you very much.
Okay, before we wrap up the section, Dr. Shine, I know this cannot be overemphasized. What general advice do you have for parents whose children are suffering from seizures, or adults whose friends are suffering from seizures? What general advice do you have for them?
Okay, thanks a lot. My advice to those listening to us now is that if you have a child, or you have a relative that is suffering from a seizure disorder, or if you are the one suffering from seizure disorder, my advice to you is go and see a medical doctor now. And like now, go and see a medical doctor, so that you would be properly evaluated and be treated. Because what is causing the seizure may just be something that can be treated so easily, right? Like, for example, I just mentioned a brain tumor. Some may just have a brain tumor and doesn't know. And maybe they are just saying this person has a mental illness. They're just saying that this person is behaving abnormally. People are saying a lot of things, and the person doesn't know. And the person doesn't know because the person has not gone to see a doctor, has not been evaluated. So solving the problem starts from identifying that there is a problem and then going to see a medical doctor. And when you say medical doctor, the person would then evaluate you and then would then request for investigations. Part of those investigations would be, a brain MRI, like I mentioned, with contrast, or a CT scan, as the case may be. And so once the problem is identified, if it's a brain tumor, you get surgery. I mean, okay, now let me just tell you, sir, where I work, right, at the Duke's Neurosurgery Specialist Hospital, we provide, world-class, facilities as well as care for patients who have seizure disorders. And we've treated patients who have brain tumors as the cause of the seizures. And with that, the seizures are controlled, right? So I think that, people listening, they should know that in Nigeria, we have all it takes to treat, people like this. So whether it's a child, whether it's an adult, we have all it takes to treat, to treat them. So, but people need to understand, they need to be aware of this, and they need to identify, whenever someone has a seizure. And then they need to bring the person to the hospital to see a doctor, okay? So if you take the person to a doctor and, sometimes there are people who live in rural areas. I think we should also address this. They live in rural areas and maybe they have a health center, or maybe they have a doctor, a general hospital, and when they go there, they don't have a specialist, right? So every medical doctor, should be able to identify a seizure and would at least start the person on an anti-seizure medication, and then appropriately refer the person to a neurologist or a neurosurgeon for further care. So that is basically what can be done, especially in those areas. But if you're opportune to have access to a neurologist or neurosurgeon, please go see one and let the person treat you for that condition. So that's my advice to people. Thanks a lot.
Thank you very much, sir. Thank you. So we've come to the end of today's episode of Health Conversation with Dukes, and I'm sure our viewers have been enlightened on what seizure disorder is, the causes, the presentation, and how to manage this, and what to do as a bystander if you see someone having a seizure. And we also tackled major misconceptions that people believe seizure is not a spiritual attack. Having seizure does not mean you have to rub oil or onion. Those we've tackled all this. So please pay attention. And if someone is having a seizure, refer them to see the medical doctor, a specialist, like we said, a neurologist or a neurosurgeon that can adequately manage this condition. So stay tuned for our next episode. Thank you very much.
Once again, we want to say a very big thank you to Dr. Ifeanyi, our guest on today's podcast.
Thank you very much,
Thank you so much. Thank you very much.
So viewers watching, listening, as we've always reinstated over and over, this podcast is set aside to learn, relearn, and unlearn. There are things you might not have heard before, but you have the opportunity of listening and hearing it over this podcast. What you can do for us is to please subscribe, like, share to your friends home and abroad. Let them learn what you're learning. So we'll come your way again in another beautiful series of Health Conversation with Dukes. We'll say from this end, bye-bye. We love you.